Everyone, please welcome the Minister for Health, Jillian Skinner.
Thank you very much indeed, and I'd like to start by acknowledging the traditional custodians of the land upon which we meet and pay my respects to elders past and present. First of all, I wish to acknowledge you, Les, also Jackie and Harry. I think it's great that you've got your family members here, and I know that they have contributed a great deal to the success that you've had, because you don't get to do the things that you do without tremendous support from home. I also want to acknowledge Dame Murray Bashir, the beloved former Governor of New South Wales, Justice Peter Garling, Judge John Hatzistergos, a former Health Minister, as is Ron Phillips here tonight as Chair of the Board of Sydney Local Health District. Also my parliamentary colleagues Gabrielle Upton, Bruce Notley-Smith and Matthew Daly, Christine Bennett, Mary Foley, David Bennett, who played that beautiful piano. I've known David for years, and I didn't know he was such a talented pianist. Yes, thank you, David. And so many other luminaries here. I think this dinner has been a simply wonderful celebration of Les's long and outstanding career, not only over the last 5 years as the New South Wales Chief Paediatrician, but over the past 40 years. His role, as has been described, of Les as an academic, researcher, clinician, hospital executive, and a very successful fundraiser, and a champion bloke, has been very well articulated. But as well, Les has played an important role in providing strategic policy advice. And I can well recall, actually, the first time I really touched base with Les. I don't know if you remember this, Les. We were doing some kind of launch at the Sydney Children's Hospital at Randwick. I was a new health minister, and the media scrum were there. There'd been a report from the coroner put out that day about the death of a child, a tragic death of a child, some couple of years earlier. And I knew that I was going to face that media scrum and they were going to test me out to see how much I knew. So I sidled up to Les, and I had the quickest brief you've ever had in your life. And sure enough, the questions came: what sort of surgery should be provided, where, etc. Justice Garling, you very much understand these questions. And in fact, I had all of the answers. And then, of course, I thanked Les and suggested that maybe the media would like to talk to him as well. And when he was asked to comment further, his answer was exactly spot on. He said, "I think the minister has covered it." And well done, Les. Diplomatic is another word I would describe. But really, he has been tremendously supportive whenever I've wanted advice about particular issues to do with children, and his role when we established Kids and Families and on the very many boards that I've been involved with has been absolutely fantastic. He's provided regular and long-standing input into the development of paediatric healthcare policy at the top level over the last 25 years. He's led regional, statewide, national and international collaborations in paediatric research, in system improvement, in quality and safety, consumer participation, children's rights, children's childhood death and injury, and fundraising and education. A truly amazing and very impressive list of achievements. His reputation saw him invited to lead the review of the Lady Cilento Children's Hospital at Brisbane, and I think I heard there were some people from Brisbane here today, which is, here we are. Fantastic that you've come down for this occasion. Les has a long-standing leadership role with the Sydney Children's Hospital and Children's Healthcare Australasia, and helped to establish the New South Wales Children's Healthcare Networks in 2001. However, I think it's been through his appointment as the inaugural New South Wales Chief Paediatrician in 2011 that Les has had the opportunity to use his extraordinary leadership skills to better connect, to integrate and to influence the system of children's healthcare in New South Wales. And I think you've seen this in so many of the comments on the video and through the panel tonight. It doesn't matter what area of child health, whether it's children with disabilities, with intellectual disabilities, where children in rural and remote areas, it doesn't matter, or Aboriginal, children of coloured backgrounds, it doesn't matter what you're talking about. He's worked tirelessly to implement many of the recommendations of the 2009 Garling report into acute care services in New South Wales public hospitals in relation to children. He's led numerous system changes to ensure that safe and high quality care is provided to children in our hospitals, and that the need of children and their families is at the heart of all of our decisions. I should also say, because of the work we've been doing in integrated care, care outside the hospital setting, in community settings, in primary health care, to keep children and patients out of the hospital and out of unnecessary hospitalisation, he's made a major contribution in that as well. It's been marked by his overwhelming desire to continually improve the system of care we provide to children. He's done this by looking at lessons learned, as well as trialling new emerging research findings into practice. This approach of Les's has been instrumental in the development of policies and guidelines to improve quality and safety systems in children's healthcare, including paediatric IV fluids and the Surgery for Children in Metropolitan Sydney Strategic Framework in 2015, which was one that I was passionately concerned to get done. He has also been a key driver in research into preventing and responding to childhood injury, and his measured hand was at the tiller of policies and guidelines developed for paediatric sepsis and paediatric emergency guidelines in 2014-16. He's also been the New South Wales Health Representative on the Child Death Review Team for the Office of the Ombudsman since 2012, making recommendations which have sparked substantial projects to reduce mortality in childhood. Most recently, Les has led the Office of Kids and Families on the New South Wales Paediatric Service Capability Project, which entails building capabilities in paediatric service delivery across New South Wales, particularly in continuity of care, as young people with complex conditions transition to adult services. And this is a new and very exciting direction in the development of paediatric care, right across from the children's hospital campuses through to adult campuses. Watch this space for the marvellous work that's been done at Westmead, but also elsewhere. And of course, noting that this has also been a hallmark of the tertiary service up at John Hunter. Les's extensive networks across all of New South Wales Health have smoothed the consultation process across all New South Wales health facilities. He has mentioned clinicians, policymakers and future leaders equally devoted. He has mentored clinicians, policymakers and future leaders equally devoted to the care and wellbeing of children. I think he's mentored a couple of health ministers as well. I have no doubt this contribution, understanding and passion for children's healthcare will be missed by everyone who has relied upon his experience and wisdom, and I mean on a daily basis. But I actually agree with the Prime Minister that I don't think Les is going to really retire. Sorry about this, Jackie. He'll be back on boards. He will be too missed not to have him reappointed to boards, maybe in a different capacity. But Les, thank you enormously for what you've done, and I know what you will continue to do. Thank you.